Okay, hi everyone. Um, we're just gonna start now. So there were 8 people who signed up, but the one person who was here left because going to send them the recording anyway. So we will just start recording, and there's nobody here, but it's okay. I'll just start recording. So talking to myself essentially. Um, because I promised those people that I will send them the recording. So I guess they will just watch the recording. Okay, so on this screen, you'll see that there's a QR code you can scan, and you can download the app. I have also typed into the chat the website to the app. You can go to your phone under apps. You can just key in Know Your Lemon, and you'll be able to download or find the app very easily. So encourage you to do so now. Then as we are going through the session, you can follow it much more easily. Okay, so I want to welcome you to today's session. And just know that this session is for educational purposes, that it doesn't replace individual advice from medical professionals. And this is only on the educational as mentioned. So those of you who are watching this, where you coming from? So I plan to also put this on YouTube, so you can type into the chat where you're from, where you're from. Okay, so welcome to the class, and I'm glad you're here. So a bit about myself. My name is Martha. I am a relationship counselor, clinical sexologist at Know Your Lemons Foundation. I am a volunteer. I'm not paid. So this is in my personal capacity. I've gone through their training, and I am a certified global educator, just like many other people around the world. And towards the end of the session, if you're interested, you can also apply to be one of us. So the mission of Know Your Lemons Foundation, this is a charity. It is to improve early detection for breast cancer worldwide through creative and empowering education. So this is a non-profit, and the vision is so that we see fewer mothers, sisters, friends, aunts, grandmothers die from breast cancer because they are better informed on symptoms, screening, and risk. So this map shows you all the educators around the world. And after today, there will be a dot to represent this session also. Sorry, these are all the education centers, not the educators. So yes, if you like, raise your hand, or at least those of you watching the recording, make a guess. How many people here know someone who has had breast cancer? Okay, we don't really talk so much about breast health, and for some people this is very scary, embarrassing. Today we are going to talk about it in a creative way, and I'm excited for what I'm going to be sharing with you. So I'm going to introduce myself in a minute, but I think because breast cancer is so common, I think pretty much every single one of us know at least one or a few people with breast cancer. So at this moment, just think about them. You can type into the chat comment section in this recording. So where did this class come from? So I want to share with you the Know Your Lemons story. So this is Corinne Ellsworth Beth, sorry, Beaumont. So she is the founder of Know Your Lemons Foundation and also the designer behind this creative campaign. So both her grandparents, grandmothers died from breast cancer, and also a really close friend. So she realized that no one was talking about how to take better care of breast health. So she decided to research how she can protect herself. So she talked to doctors, nurses, put herself in the shoes of the patient, tried out mammogram at 21 to know what it felt like. So she went through every step of the detection process to really understand what it takes to find breast cancer early. And you know what she discovered? No one was teaching about breast health. So not in school, not in families, not friends. So it literally took several people dying for her to be motivated enough to learn this. And she didn't want it to be this way for other people. So she designed a way to make learning about breast health engaging, easy to learn, something that can overcome the barriers that have held breast cancer education back for decades. So taboo, fear, literacy. So she got her PhD in how to design a campaign that educates and works for everyone that I'll be sharing with you today. So Corinne, she started this charity with her savings as a single mom. And today, Know Your Lemons has been seen online by 1.85 billion people, not million, billion. And it has been translated to 36 languages. It has saved many lives by helping women feel empowered and confident on how to identify symptoms, report them, get tested, and get screened. So as a volunteer, I'm part of the team helping to change the picture of breast cancer. And I'm just so thrilled to be able to teach this class with you and recording it so they can benefit more people. So we're going to learn a lot of great things together. And I hope you can share this information, this recording with others, and invite me to teach classes with groups that you are involved in too. So this is me, why I got involved. I'm a born and bred Singaporean, and I am a sex relationship counselor, as I mentioned. And I decided to be a volunteer because it is true that breast cancer is not talked about enough, even though it seems like it is a lot. Um, I think when I went for the educator training, I realized there were so many things I didn't know, and I found it really useful. And I'm really inspired to teach more people to recognize the 12 signs of breast cancer. And early detection really can save lives. So the content I'm going to share with you is so important. So yes, so now quiz time. Okay, can men get breast cancer? Okay, men also have breast, right? They can get breast cancer, of course. So it is very rare. So 1% of those diagnosed with breast cancer are men, okay? So another question. So okay, this is not a question, but like around the world, everyone somebody is diagnosed with breast cancer every how many seconds? Is it 30 seconds? Is it 1 minute? Is it 15 seconds? Make a guess. Make a guess, make a guess. Okay, so it is every 15 seconds, there is one person diagnosed with cancer, breast cancer. And breast cancer is now the most common cancer in the world as of 2021. So this is very, very common. The fact that it is common, yet so many of us are not getting the education. So while most people will not get breast cancer in their lifetime, many of us know someone who has had it. And some of us in the class have experienced it for ourselves. That's why I'm a bit teary. My mom died of breast cancer. And we may be aware that breast cancer exists, but we actually don't know much. So let's go from being aware of it to being educated. So about half the population who are affected by breast cancer, which area do you think is the most common? So one reason why women's health, there is lack of health equity. We tend to be less heard of or dismissed when we bring a concern to a doctor compared to men. Breasts are considered taboo and difficult to talk about. So some people, they keep the breast symptom to themselves. So opening up the conversation about breast health today is how we can overcome a big part of this problem. Survival also depends on what services are available to you, whether it's easier or harder to get tested and diagnosed where you live. And so here is a map of the places in the world where deaths from breast cancer are the highest. So countries in pink are the most deaths. The place in blue and green have less deaths. So this is where I am, Asia. You can say Malaysia is here. So yeah, I'm here. I'm here in Singapore. This little dot that is not even a dot here. Okay, so here is a comparison. And according to World Health Organization, okay, together with World Health Organization, we want to change this picture so it doesn't matter where you are living. So yes, the survival rates. So 80 to 90% of women survive breast cancer if they live in high-income countries like North America, Sweden, Japan. 60% survive in middle-income countries. 40% or lower survive in low-income countries. So like Africa. Okay, so some of this is due to women not knowing the symptoms. If you don't know what to look out for, you wouldn't know, right? Not knowing the symptoms to not showing it to the doctor. Doctor also not sure how to investigate because no access to testing equipment, for instance. So while other organizations are looking at ways to improve treatment and access to care, so we are working to help women report symptoms more easily and help doctors to recognize symptoms and listen better through education. Now that you understand more about the problems of breast cancer worldwide, so let's start learning about what you can do to improve early detection for you. Okay, make it relevant to you. So we can change the map. So let's me show you how. So there is actually let's say a 5-year survival rate of breast cancer according to what stage it is found. So in 5 years, if you detect it early, actually there's a 99% survival rate. This is very, very high. But when it is not in the early stages, let's say the later stage, like stage 4, this is when the survival rate is low and then it becomes a lifelong disease. So it's really important detect early. So to actually be able to detect early, you need 2 things. You need to know the symptoms, you need to know what to look for, and know when to get screened according to your risk level. So in the US, okay, it is a survival rate, a 5-year relative survival rates of breast cancer. So as a charity, early detection is the sole focus. We want to help more people get diagnosed in the early stages, so survival rate is higher. So what did you learn about breast in school? Did you learn anything about breast in school? Okay, think about it. So when we can talk about breast health, we actually can improve breast health. The people who live the best are the people who are the most informed and educated. So when we are educated and empowered, we can better advocate for ourselves. So let's start with these 2 lemons. They decided to use lemons because sometimes breasts are also referred to as lemons, but also how do you show something like this without censorship and all these sensitivities across different cultures, language, religion, things like that. So that's why lemons. And so let's look at these 2 lemons. Lemons can teach us a lot about breast health. You will never look at them the same after today. So there are 12 signs we are going to go through. So one of the things you really want to remember, you can say it's an analogy, is the lemon seed that is in the lemon. Okay, that will be the approximate feeling and size of what a worrying lump will look like. Okay. And so how many symptoms of breast cancer can you name besides a lump? I think we all heard about this at some point or another. Lump, right? For breast cancer, found a lump. But really, besides lump, there are actually other signs. There are other signs. Okay. So we are going to go through each of them. Also want to add about this lemon seed, right? Just now I mentioned it is usually immovable, cannot move. Okay, cannot move. So cancer is when the cells in your body don't grow and die as they normally do. They take over parts of your body and cause damage. So finding them early is important. Okay, so here are the symptoms. Okay, so this is a award-winning diagram. They have put this into posters. And when I have seen them, I actually didn't realize all the lemons actually look different in the visual until I went for the training. I was like, yeah, lemon, lemon, you know, ha ha ha. But actually, this is such a powerful image. So this was actually in a clinic when few people who have seen this actually realized there was something worrying, and they went to seek help, and actually it saved their life. So we just go through quickly. So the first one is the thick area. So that like the breast, there's area that feels thicker than the other areas, thicker. So don't confuse it with changes that happens during your period, which is why the breast examination should be done after your period. We'll talk more about it. So there's also the breast dimple, it concave inside. So this is another sign, nipple crust, so like discharge, not from breastfeeding, or like, of course, if there's blood, it is very worrying. Not from breastfeeding. So there's nipple crust, pain or ache in one spot. Okay, if there's pain or ache, new fluid discharge. Okay, new as in like normally this never happens. Another one is skin sore. So it's like I guess like what this picture is showing, like some growth on it. Bump, something that is protruding. Growing vein on the breast, growing vein. Sunken nipple is sunken. New shape and size. So again, the emphasis is on new, which means it's usually not like this. Another one is orange peel. So don't think of it like the color. Think of it like the 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 way it looks. Okay, not the color. Another one is we already talked about this, the hard lump. So it's important to mention, I think I mentioned a few times already, that breastfeeding causes many changes, which is normal, but not all breast changes are cancer. So there's a lot of harmless reasons why one might notice a change in the breast. And if the symptoms get worse or stay longer than the menstrual cycle, when you're having your period, that means after your period, you need to be examined by a doctor. So you also should trust your instincts. So being connected with your own body is important. So this is where the free Know Your Lemon app comes in. You can download because it explains each of these symptoms in more detail. You can read more and what to do if you notice a change. So there are steps to encourage you to seek help. And it guides you step by step how to talk to your doctor, what to bring up to your doctor, what tests you should be offered. So this app is free and useful. So they don't track your contact, by the way. You will get a notification every month of when you should do your examination. So it's a reminder. So it's important to do it at the same time every month so that you can compare with previous. So I'm going to want to play a little game with you. Is that okay? Play a game? Okay, go to round one. So just now I described the symptoms, right? So these are, okay, how to play. So what is this? This is what? Do you remember? This is what? Okay, so we're going to try to match this with the symptom. Okay, nipple crust, lump, new fluid, new fluid. This is a new fluid. No, this one is the new fluid. Yes, match. So discharge from the nipple is common and benign, harmless most of the time. It is usually related to developing breast, infection, cyst, pregnancy and breastfeeding. However, if fluid is leaking from the breast outside of these changes, it should be checked out, especially if it's clear or contains blood. So fluid. Okay, so these are pair. Okay, let's try another one. Okay, this is the lump. Hard lump, yes, lump. So the most common sign of breast cancer is a lump in the breast. It usually feels hard like a lemon seed and can become more immovable as it grows. It can be any shape or size. It's different from normal lumps, which come and go with the menstrual cycle. are usually movable and not hard like a seed. So a mammogram can help the cancerous lump, help you to find before it can be felt, okay? But let you know, mammogram, we all hear about mammogram. They say go for mammogram, go for mammogram. During breast cancer awareness month, every October, there are places in Singapore that actually offers free mammogram. Please go. But just to let you know, from attending the training, I learned that the mammogram only pick up 50% of the cases. So we'll explain more why later. So it is okay, it is important to go for your own check. Okay, dimple. This one is what? Oh my God. Okay, nipple crust. Yes, nipple. Okay, crust on the nipple can be harmless skin condition. It's also a common problem with breastfeeding, but it can also be a sign of Paget's disease, which is a rare form of breast cancer found in the nipple or areola. Okay. Just to let you know, I actually wear the nipple sticker. I wear nipple sticker. I hate to wear bras. Always the bra wire hurts me a lot. So actually, since I started to wear the nipple sticker every day, I do feel itchy on my breast. So that has to do with the sticker, right? Not the breast. Okay, so this one dimple. I think dimple is this one. No, dimple? Yeah, dimple. Okay, dimple. Sometimes deep tight clothing can cause a temporary mark, which is harmless, but this symptom is caused when the tumor deep in the breast pulls the skin inwards, causing it to indent. Tumor deep inside, because there's something inside. So it's like pulling, right? So sometimes this lump can be felt and sometimes it cannot. So dimple is one of the other signs also. Isn't this useful? Okay, pain. I think this one is pain. Pain. Okay, so pain or itchy in one spot. Just now I was trying to describe you about my nipple sticker, right? So breast pain is very common and most often harmless, usually related to hormones and menstrual cycle changes. However, if the pain is in one spot, persistent, so doesn't change with your menstrual cycle or gets worse. If it's persistent or gets worse, it should be checked like any unexplained pain anywhere in your body. Pain is also more suspicious if another breast cancer symptom is present. So there are 12 symptoms like pain. Itching of the breast is usually not a symptom of breast cancer. However, sometimes cancer can interfere with nerve endings, which cause itchy sensation that doesn't go away, okay, such as inflammatory breast cancer. Okay, and then I guess these two, thick area. So some types of breast cancer do not form hard lumps. Instead, they cause thickening of the breast skin and tissue. And people say it feels like their skin is thicker or part of their breast feels hardened. This symptom can be more difficult to detect during breast cancer screening because it's thicker. So make it more difficult. So this is why feeling is very important. Don't be embarrassed to touch yourself. Okay, congrats. So we finished round one. Do you like this game? Okay, there's somebody else in this room now. Okay, let's go for round two. Round two, ready? Okay, this one is vein. This one is vein. That one is bump. No, that was not bump. This one is uh, this one? No. See, I'm also learning. Okay, growing veins. So enlarged veins are a rarer symptom of breast cancer. Is more rare. Usually this symptom is connected to weight gain or breastfeeding. It's a rare benign condition called Mondor's disease, but if the veins become more pronounced outside of these changes, such as the breast or near the collarbone, sometimes accompanied by a swollen arm, this could be a sign of a tumor drawing more blood to itself and the vein swelling in size or allowing for additional blood flow. Okay, so growing veins is another possible symptom. Orange? No. Orange? No. Orange? Bump. Bump. Okay, this one No. Okay, trying to find the matching may take a while because my memory is not good. New shape. This one, new shape. Okay. It's common for one breast to be different in size and shape from the other. This kind of variety is what our bodies are known for, different shape and size. Breastfeeding can also cause changes in shape and size as a result of milk production. But if one breast changes size, flattens, swells, or droops unexpectedly, and it doesn't seem to be connected to your menstrual cycle, this could be a sign of breast cancer. So shape and size. Shape and size. Okay, this one, orange. Okay, got it. So orange peel. Okay, if the breast changes color, reddish or dark, texture, such as rash or dimpled skin like orange peel, that's why they call it orange peel, and feels hot, it is often a sign of infection, developing breast, breastfeeding, or eczema. If time, antibiotics, and other treatments are not resolving, this could be a symptom of inflammatory breast cancer. This symptom may be difficult to see in a mammogram because it doesn't form an obvious lump. So reporting skin changes to doctors is smart, okay? So the mammogram will not be able to tell what you see. So wrinkly, a bit like cellulite, isn't it? Okay. Symptom. Okay, this one is okay, newly inverted nipple, not just inverted, because there are people with inverted nipples. This is not how it usually is, newly. So retracted nipples can be normal if it is how they are first developed. But if you notice the nipple sinking, flattening, or turning from where it used to be, it can be a sign of breast cancer tumor forming underneath, pulling the nipple towards itself as it grows. This one, bump. Okay, bump. Sometimes a cancerous lump grows on the surface of the breast, and not all lumps or bumps are cancer. Breast contains ducts, loops, and lymph nodes too. That is a normal part of breast anatomy. This symptom should not be confused with an injury to the breast, which may cause a temporary lump. Okay. Last one, skin sores. So this is sore. So what is this? So breast cancer can sometimes build up to a point that it breaks down the skin of the breast to form a new wound. Sorry, open wound. This is the advanced stage of the disease. Infection may cause a bad smell or leakage. This is often accompanied by an obvious hard lump. So this one is usually more advanced stage. Okay, so be mindful of that. Okay, I think we finished the whole game. Okay, so fun, right, this game? Let's go back to the slides. Let's go back to the slides. Okay, so this is the game, knowyourlemons.org/games. Can play with your children if you have children, daughters, or boy. Of course, it only affects 1%, but still it's a fun thing to remember. Remember, the more all of us know about it, the more we can save people's lives, right? Okay, so this is Lindsay's story. Wait, I just want to make sure I have the sound. Just a moment, Check. Yeah, you see, I didn't connect the sound. Okay, come. Let's watch Lindsay's story.
Hi, my name is Lindsay and I was diagnosed with breast cancer at the start of this year at the age of 24. I remember it really clearly. It was just after New Year's and my boyfriend showed me the classic 12 symptoms of breast cancer with the Know Your Lemons carton. I remember seeing it and thinking, oh, this is a brilliant way to show people what to look out for, because I didn't know half of them. And just over a week later, I remember finding a small lump under my armpit and thought, this isn't my usual normal. And I think due to seeing the carton previously, I went to the doctor and a few weeks later it turned out to be breast cancer. So this is why it's so unbelievably important to promote Know Your Lemons and make sure that people know what to look out for so they can get detected early. Thanks.
So the more we are educated, the more we have early detection, the more lives it will save. 99% of people can go on to be able to survive. So what percentage of women know all the signs of breast cancer? So let's make a guess. Just now we went through the 12 signs. Like I said, when I went for the training, I didn't know what I didn't know, and I realized there's so many things I didn't know. So what percentage of women know all the signs of breast cancer? Okay, the answer is 2%. 2%. It's very, very little. You see, I also didn't know, right? So you can help us to change this number. Okay, how about this one? How many people report doing a self-examination with confidence each month? Is it 48, 33, 15, 17 or 9%? You know how to do a breast examination. So what do you think is the answer? Okay, so the answer is 9%. So we hope to change this to 100% that all of you know this. This is why the cheat sheet, the 12 signs with the visual of the 12 lemons, I think is so good. So they really went for design training. So now let's watch a short video about the symptoms and self-examination. Okay, and after this video, you can share with us one new thing you learned. You can put into the comments. And I'm going to put this video on YouTube, so you can put this also. So let's watch this video. It's really fun.
Hi, I'm the mayor of Lemonland, and I'm here to help you know your lemons with my friend, Mona Lisa.
I've been checking my lemons for 500 years and have a lot to tell you. A cancerous lump is a lot like a lemon seed because it often feels hard and immovable. It can be any shape or size. This is the lump you investigate. There are two innocent lumps to know. One lump feels like a soft pea. These are your milk lobes, normal. Another lump feels like a soft bean. These are your lymph nodes, also normal. But you need to know how to feel around for these good and not so good lumps. Mayor, do your thing.
Thanks, Mona. Use your 3 middle fingers in circular or up and down motions. Use 3 levels of pressure: light, medium, then deep enough to fill your ribs. Also, fill under the nipple. You need to cover an area that includes your lymph nodes. So start in your armpit, then to your collarbone, and finally work your way down to the bottom of your ribs. Use 2 positions. 1, lay down with your arm behind your head. This flattens everything. 2, bend forward. This brings everything to the front. Finally, look for changes in front of a mirror. Move your arms up and down and turn to the side. See if the whole breast skin moves with you as you move your arms.
And look for these changes.
Because a lump is not the only sign.
Grazie, Mayor. The best time to feel around is 3 days after the end of your period, when everything is most normal. No period? Pick any day you like, consistently each month. Your risk increases with age, so stick with it. I've been checking my lemons, but it's not enough. I also get regular mammograms. Because a mammogram can find a cancerous lump before it can be felt. Just look at my hand to learn the difference. This is the average size of a lump found by accident. A lump through self-exam. A lump found with 1 mammogram. But with several mammograms to compare changes, the lump can be the smallest. If cancer is present in the breast, 8 times out of 10, a mammogram can find it. But if the results come back normal and you're still concerned about something, or if you're too young for a mammogram, ask about an ultrasound if you have a specific lump in mind, or get a new view with an MRI. But the only way to determine if it's cancer is to actually look at the cells, which is through a biopsy. Most lumps turn out to be fine, so don't panic if you need to check it out to be sure. Trust your instincts and know your options. When breast cancer is found early, survival rates are very high. Knowing that I've educated you makes me smile.
Share this app with a friend today at knowyourlemons.com.
Yes. So how was that video? Just a moment. Okay. So here we can actually do the examination together with the, wait, yeah, sorry. Okay, this video doesn't really go to the next slide so easily. That's why I have to, oh yeah. Okay, just a moment. I always have problem at this part. Go to the next part. Go to the next part. Yes, okay, now can already. Okay, so just now mentioned different parts of our breast. And here you have the nipple. Here you have the milk ducts. So these ones are harmless. And then these one are the ones for the lymph nodes. And then this is the lump. So actually they are not to be confused as one and the same thing. So how you do the examination is you go from, for me, I will go from the right side, you go above your collar, and then you go under your breast. So always like do it in the right way. And now you know you don't just do examination of your breast only. There's also the lymph nodes to look into. So when we have flu, maybe you have felt inflammation, like certain parts of your body swollen. Actually, that's the lymph nodes, like when you have flu. So usually like around your throat, right? So that's the lymph nodes. Our whole body have lymph nodes. It's like a filter. So when we check, this is the reason why we also check the above part of our chest, not just the breast. Okay, so when you download the app, actually there's a video that will guide you to go through it properly. So let's do the examination together. So besides going on this circular motion, just now they mentioned 3 different ways to touch yourself, the skin, lower, and also your rib cage. So being able to go through all the different layers is important. Okay, and then this part of raising your arm, right? Then look at this, like we are looking for the lymph nodes. Okay, so what we are looking for, the milk lobes, the lymph nodes can feel like soft beans, and then the cancerous lump. Okay, just now mentioned already, this will be where it may be. Okay, so a lump can be any shape or size, and it can also feel like a thick mass too. Okay, so now I'm going to try, okay? Try to do the breast examination. So you lift your arm above, and then for me, I will just go from here, and then I will go this part. Okay, so you use your 3 fingers to go round and round, and try to go from different like depths. And then here, okay, you don't have to do it with me if you feel shy, but you can do it in your own time. So use your finger, draw a line across your body, just like the picture. Draw a line, right? So the breast tissue spans from your chest to your armpits to your collarbones. Okay, this is all the area that you should feel during the self-examination. We show you already, right? The lymph nodes. So actually, these are the areas that I never knew we even need to go and look into. So I say how hard? When you can feel your rib cage, when you can feel your rib cage. Also under your breast also. Okay? Okay, so this is how you may do it. And just now they also showed different position. One is lying down, one is hunched over, and one is in front of the mirror. So when you do it in front of the mirror, you do this, so you can see whether the skin moves and whether there's any like if it's not lifting the way it should. So that is also another thing that I didn't know previously. Okay, let's go back to the slides. Remember this one? You lie down, you hunch back, and then you do it in front of the mirror. So these are the 3 positions that you can do the check with. So just now I showed like how to do, right? So in each of these positions you can do. But this one in front of the mirror, you're actually testing for whether your breast will move. Because if there's growth, you know, it will impede the movement. So this is why you do it in front of the mirror. Okay? Okay, I think I went through everything already. So don't be embarrassed to really look every month at the same time if possible. This is where the app comes in and it will send you a reminder. So when you do it in front of the mirror, okay, you look for change, you look for symmetry, you look for you turn to the side also, and you see whether the breast skin will move with you. You see whether you can have there's this symptom, right? The dimple symptom, any area concave. So this is what happens when the lump that is inside, right, is pulling the skin inwards. So see whether there's any dimple. Dimple can be there for innocent reason, like tight-fitting clothes, right, or scar tissue, cellulite. So really look, really look. So when you track you know your body, you track your breast health, then when there's any change, you will be very sensitive to it. Okay, like I mentioned already a few times, earlier detection means it will save your life. So not just be like uncomfortable and then don't do it. So do it every month. It will just take 10 minutes of it. Like if you want to do very fast, okay, 5 minutes. So also write down what you notice, whether one breast is bigger than the other. So like what is your so-called normal? And if one breast is lower, so that later on when you see any changes, you can compare easily. So this is your own body. I don't know how you feel about taking photo of your own breast so that you can see. That is also another way of being able to take care of yourself. Of course, you know, take photo must be mindful of confidentiality, privacy, and all that. So when you feel one side, you feel the other side. Okay, is it both the same? If it's a lump, does it come and go during your menstrual cycle? This can be related to changing hormones, which is normal, but just trust your instinct. When anything doesn't seem right, you have it looked by your doctor and you understand your options before getting answers. So the app will help you with that. Okay, so now I'm going to invite you to put up your hand. Just now we talked about the different sizes. So I want you to know that the 3 finger, right, this big circle. Okay, I put up my hand and then the thing also put up my hand. What this? How to put down my hand? Okay, when I put up my hand, this is the. I stop share and show you. You see, the moment I put up my hand, the app, the Zoom also put up the hand. Okay, put down, put down. Okay, I show you. So the hand, this shape, this one is the size of found the lump by accident. Like your partner touching you, you found it by accident. Okay. This one is when you do self-examination. This is about the size of it. Then this one is from mammogram. This is the approximate size. When you do mammogram, they can detect this size. So self-examination, you can find smaller mammogram. And then this one is multiple mammograms. Just now I mentioned that mammogram actually only detect about 50% of the cases. That's because of the breast tissue. Some breast actually looks more dense, means thicker and actually hard to tell from the x-ray. So when you suspect, Okay, mammogram is not the only way they test. There is also, just now they mentioned, ultrasound and MRI, biopsy. So these are the ways that they do the assessment. Actually, it's much more reassuring knowing that there are all these different things to test. Okay, so this is one way to remember. Okay, accident, self-examination, usually can even tell this size, the size of your thumb. And then there's the mammogram and then multiple mammograms. Okay, found by accident. So it is showing to me when I learned this, it was showing to me that actually regular examination, there's really a lot of benefit because you are with your own body all the time, right? But mammogram could potentially be able to detect something even smaller. Okay, so some parts of the world, they don't have mammograms. So we are very lucky we can go for mammograms in our country, Singapore. Okay, so when a lump is found, okay, what is the average size of the lump found through regular self-examination? This is a quiz. So which one is it? Is it this one or this one? I think I repeated twice, right? Okay, it's this one, okay? Self-examination, you can probably tell. It's this one. Okay, next. For those who notice the symptom themselves, didn't go through mammogram, how many found it by accident versus self-examination? So found by accident is usually 70%. Self-examination is 25. Okay, I think one of the big reason is we are not doing it properly. That's one big one. The next one is a lot of us are not even doing it. We just, don't know what to do. So this was a big learning for me. So yes, a lot of people actually found it through accident. So together with more information knowledge and also the app can help us, we can change the world. Okay, so for women at screening age, how many found it themselves versus a mammogram? So mammogram actually helps about close to 50% of people versus they found a symptom. First, we need to know what to look out for. Okay, can you see why it is so important that we share this information with more people? So maybe we can discuss or maybe have a little think. What will help you to be better at self-examination? Now that you know all these, what will help you to be better? I think doing it at the same day, same time is useful. So they said 3 days after your period, 3 days after your period, but I have actually seen literature online that says 5 days, 7 days, 9 days, because our cycle, if you break it into 4 phases, each phase is like 7 days. So basically after your period, before you go into the next phase. So yeah, so for Know Your Lemon, they actually say 3 days because this is when your breast will be less sensitive also because of all the hormonal change. So it's good to peg it to a time every month that you remember. And because some people have a longer cycle, shorter cycle, so it's good to use the app because you can actually adjust on the app. Just you can just play with the circle. It's quite easy to use. Okay, so this is the app. So self-examination and mammogram should be timed to your breast cycle. So the app will send you reminder whether you have periods or not. So if you don't have periods anymore, menopause, if you don't have periods, or you're a man who doesn't have period, so what happens is they will actually send a reminder to you on the 1st of every month. And you can, okay, so when you download the app, right, you can adjust this green thing that I'm showing you. I'm pointing to the green. So you can adjust your cycle because some people's cycle is longer, some people's cycle is shorter. So how many days is one cycle? And then this yellow one, you can also adjust like which day you want to get the notification. Okay, so then there is a recording where you can just follow the instructions, and then it's like they gamify this process, right? They gamify it. So they will tell you, okay, you have done how many breast check and all that. So yes, you just follow this audio and they will guide you. They will guide you. But also, if you don't want to follow this audio, I think I have already explained how to do it with the different positions. Okay, the different levels of your skin, and also the direction, and also what to look out for, not just your breast, but also your lymph nodes. Okay, so go on a round, move your hands in the circular motion. Okay, so these are things that I also didn't know before I went for the training. So that's very useful. Okay, so so now these are the different 6 stages with when you find a symptom. So what you do is when you notice a symptom, okay, the first step is talk to your doctor. The doctor usually will ask for mammogram. If you're above 40 or have no symptoms, you can start with mammogram. Like I mentioned, there are actually places in Singapore, if you look, they actually offer free mammogram. And this will help you to find a cancerous lump before it can be felt. So it's important. And if you get a mammogram and you want a closer look, then you go for ultrasound or breast MRI. So I was very confused about these two. So the difference is the technology behind it. So one is using sound and one is more about the precision. They magnify what is happening so you can have a closer look. So these are different process that they may choose to do, or maybe even both. And if the test don't rule out a problem, that means there's a problem, then they may choose for you to go for biopsy. So during biopsy, they will take a small sample of the tissue. They look at the cell under a microscope. That's how they determine the cancer. So both biopsy turn out to be fine. So don't worry if you have to go for it. A lot of cases I came across, I mean, this is what the statistic that I came across, 90% of cases actually is not cancer. So you often do not have to go through all these steps. I'm just explaining it because like if this happens to you, because you do not know what to expect and what is going to happen, sometimes it can be very, very scary. So it's good to also kind of like educate you. It's all just basically different kinds of check to have a clearer, better imaging. Okay, so depending on your symptom, what is available, so some tests will be in a different order, but knowing your symptoms, knowing your options can help you to navigate and know what to expect. So the Know Your Lemon app can be helpful because it will explain everything in more detail, how it works, what questions to ask. There's also a risk assessment in the app that will help you to understand what are the screening recommendations for you based on your risk. And we'll talk more about it. So you can see why I keep talking about this app, right? Because they actually are improving the app all the time with more features. So when you download it for yourself, you recommend it to a friend, is actually really helpful for them. So this is a award-winning app, by the way. It's an award-winning app. So now I want to show you the different images of breast. So actually the breast is not just it's actually there's also fat, there's tissue. So you can see here, okay, these are all images of healthy breast, but then just now I mentioned there's also such a thing called the breast tissue is very dense. So usually breast density, you can only find out whether you have a dense breast through the mammogram, and it will be explained in a mammogram report. So about half of women actually have dense breasts. And this can change when you age to become less dense and then more fat. More fat will start to happen. So knowing your breast density is important because you can talk to your doctor about what screening will be better for you, whether you have increased risk of breast cancer. So when you have a breast that's very dense, imagine you go for a mammogram, it actually cannot really tell. So this is why self-examination is so important. Okay, so how many people diagnosed with breast cancer have a family history of the disease? So this is a big misconception that I myself didn't know because my mom died of breast cancer. My mom was first diagnosed with breast cancer when I was 19. So I kept hearing my whole life, my whole freaking life, oh, because your mom has breast cancer, so you're more likely to have breast cancer. But did you actually know how many % of people who has a family history actually have this risk, okay, of breast cancer also. How many? Can you guess? Is it 85%? Is it 65%? Is it 40%? Is it 15%? Can guess? Okay, so the answer is 85%. Okay, so 85% of breast cancer in women have no history. Okay, so you have a 15% chance that this will happen to you because it happened to somebody in your family. Only 15%. So this means that a lot of people who don't have any history are being diagnosed. There's no history in the family. So this is contrary to what people think. I think this kind of misinformation needs to be corrected, isn't it? So because you think you don't have a risk, then you don't check. Okay. So I don't want to sound so fierce. I don't want to sound so fierce. Okay, so it's important to understand that having a risk for breast cancer does not mean it will happen to you. You have a risk. We have different levels of risk. You can do the risk assessment. So think of it a bit like a toto, right? Like a lucky draw. So if you have more tickets inside, then your chances of winning will be higher, so to speak, right? So if you have this ticket inside, you can still have the risk, even though you only have one ticket. Okay, so let's point to each one and explain what it means. So as you get older, your risk will be higher. Okay, more periods. So more period doesn't mean you're a lot of blood. It just means if you have more periods in your lifetime, so the estrogen actually, the period actually increase the estrogen in your body. So there's more exposure to estrogen. The next one is medication, hormones, and birth control. So not all hormone pills and birth control pills will increase your risk of breast cancer. This is a big myth a long time ago, but we are not medical doctors. So the best thing is to ask your doctor if you're not sure. Another one is being overweight after menopause because the body fat produces and store estrogen. So this will increase your risk of breast cancer. Another one is lifestyle habits, alcohol, cigarettes. So consuming moderate to increased levels of alcohol, smoking can increase your risk of breast cancer and other illnesses. And then, sorry, diseases. The next one is a sedentary lifestyle. Sedentary lifestyle, not exercising regularly, being stationary for long periods of time. Like nowadays, we don't exercise so much. We just work and sit in front of the computer all the time. So actually, these can also contribute to your risk of breast cancer and other diseases. Another one just now mentioned already, dense breasts. So half of women with over the age of 40, half actually have dense breasts. We do not know until you go for mammogram and the doctor will tell you, just now I mentioned. But it's not something you can feel, it's something reviewed in your mammogram report. So you can talk to your doctor about your breast density and the screening options for you, what is better. Lumpy breast, so there is this medical term called fibrocystic. It can cause breast pain, tenderness, and lumpiness, but it doesn't increase your chances of breast cancer. So there's a breast condition called atypical hyperplasia. Plasia is actually found through biopsy. It's basically a build-up of abnormal cells in the breast. So over time, this atypical hyperplasia cells may keep dividing, may become abnormal. It can turn into breast cancer, which is why additional screening may be required. Genetic factors just now already mentioned is actually only 10%, 15%. So family history, especially first degree relative like a mother or sister, okay, increase your risk, but you may share a genetic mutation. But like I mentioned, 85 to 90% of people with breast cancer are the first in their family to have it. First in their family to have it. So you can talk to a doctor if you have a genetic concern. So if one family member have a breast cancer gene mutation, it doesn't mean that all the family members will have it. So individual testing is needed because genes are different for different people. So don't think you're in the same family, then you will have the same risk. No, it's not true. So if it's known that you have a genetic mutation, more resources will be available if you reduce your risk, find it earlier. So some of all these things that we mentioned, lifestyle, are all factors also. So yes, download the app now and do the risk assessment. Okay, download it now. Let me know how it goes. Okay, download because later we got time, right? So let's download it. Take some time, download, and then do the risk assessment. Also, this is a good time. If you have any questions, we are almost coming to the end of session. If you have any questions, you can type into the chat box. Okay, I don't know everything, but I will see what I know, and I see whether I can help you if you have any questions. So I'm also going to put this recording on YouTube. So if you have any questions, you can just type. Okay, so now we're going to ask you to share. Did you learn something new today? Okay, going for the training, I learned so many new things. I learned about the risk, like as somebody who doesn't really been told my whole life that I'm at risk of breast cancer. It was very reassuring, and also like the 12 signs of breast cancer, and also like the different diagnostic tools really helped me a lot to be able to like not be so scared, like, oh, if this happened, then what, you know? So I felt this training was very, very useful in terms of me having more knowledge, and I wish more people have more knowledge. So knowledge is power, they say. So that's why I want to post this recording online. Okay, so this is the part where you can go and fill out feedback form. Okay, this is the first time I'm doing this training. So maybe next time when I have a better session, then I'll just put up a better recording and retire the not so good one. But yes, please give me your feedback. This link does not go to me, by the way. This link does not go to me. It goes to Know Your Lemons Global, so that they know that I have done the training. And also, I think they want to track our effectiveness, our clarity. So as part of our agreement with them is that we do not alter their material, and that is to ensure the quality of the material. So they also want to make sure that even though I'm a volunteer, they want to make sure that the quality of the session is there. So this is my first time, as I mentioned, so be kind. Yeah, so learning is a process, right? There's you can't like really expect yourself to be perfect right away. So you can see I was like referring to my notes, which is very helpful. But yes, so please give your feedback, be kind, and just let you know. Okay, I don't know how it really works, but when you fill out the feedback form, they actually give you a $5 gift card to Know Your Lemons shop. So you can actually buy things from the shop. They have like the card, you can buy the card, you can carry around or give to someone, you can buy different things, different merchandise from the shop that they have. So it's pretty good. It's pretty good. So yes, fill this up so that you can get your $5. Okay, we are almost coming to the end of it. So do your risk assessment and fill up the feedback form. I think I just like another few minutes, okay?
My tea's gone cold, I'm wondering why I got out of bed at all. The morning rain clouds up my window, and I can't see it all. And even if I could, it'd all be great. But your picture on my wall, it reminds me that it's not so bad, it's not so bad. Drank too much last night, got bills to pay. My head just feels in pain. I missed the bus and there'll be hell today. I'm late for work again, and even if I'm there, they'll all imply that I might not last the day. And then you call so bad, it's not so bad. I want to thank you for giving me the best day of my life. Oh, just to be with you is having the best day of my life.
Okay, so thank you for filling out the feedback form and doing the risk assessment. Want to ask whether you help us to spread the word about this. So one way you can help us is also to follow us on social media, to tell your friends about the app. Just like I mentioned, the app is actually constantly being improved. You can do self-examination, you can track your period, you can know about the signs, you can do your risk assessment. So it's pretty friendly. Like I mentioned, it's an award-winning app. So if not for your app, I wouldn't know how long it would have been until I found the lump myself. It is not just the fact it's a reminder, but also the audio guide that talks you through too. The app gave me confidence. I needed to know I was checking properly and what I was feeling for. Because of this app, I found my lump. It saved my life. Yes. This is the socials, Know Your Lemons on all social media, whether it's TikTok or IG or Facebook. You can do your part, go follow them, and then you can share their posts. Especially since this is Breast Cancer Awareness Month. This is the reason why I wanted to do this training. So this is Amanda. So I really believe that because of my friend's Facebook post sharing the 12 signs of breast cancer, I discovered my breast cancer on time. So this is Amanda. And here we have Jem. So Jem is a volunteer here. She's in the middle. She actually is a breast cancer survivor who wanted to help educate other people about breast health. And she's teaching her friends in this Zoom. She's teaching her friends about it. And it's as simple as that. You know, you can educate your friends of friends, your local community, your local groups, and together we can empower the world with more knowledge, of course, men too. So you can go and join to be like me, to become a certified Lemonista, or we call it a global educator. So this is Jessica. The moment I saw the 12 symptoms of breast cancer image, I knew I had breast cancer. You simply saved my life. So I'm also a bit emotional actually the last few days because, you know, my mom died of breast cancer, and it's actually been quite triggering for me. So Jessica was 28 when she was diagnosed with breast cancer. And so she knew, because she did her self-examination, she knew the 12 signs. So the knowledge helped her to feel confident to request a test, even though it wasn't standard for women her age. So it did save her life, and then she became a volunteer educator to help others. So here we have a snapshot of almost 1,000 certified Lemonista teaching in 65 countries around the world. So if you're interested, you can go and join us, knowyourlemons.org/Lemonista to submit your application. So there's so many of us doing this because obviously the content is really good. You have just experienced it, and together we can help to support people to have early detection. So if you want to donate, you can scan this code. And remember, when you donate, you are helping the work of Know Your Lemons. And when you donate, you help us to teach what you know today, to fund the campaign so that we can have more languages, provide funding to train educators like me, and make the app possible for more people to take charge of their breast health in a personalized way. So this person in this picture, her name is Brenda. So this Brenda, she grew up as an orphan in Kenya, and she became a Know Your Lemons educator. She used the campaign to teach the communities, and she grew up. And in this picture, she just finished teaching her class to 40 women entrepreneurs, 40. And after the class, there were actually 3 people who came to her where they recognized a symptom from the poster. Okay, so good, right? That 3 people actually came after knowing what they didn't know. And so Brenda helped them to get the symptom investigated, referring them to a local hospital. And because she had the tools to make the conversation easy, so all 3 were diagnosed. And donations not just provide educational materials, but actually provide funds to train educators also. For every dollar donated, you are actually helping to educate 1 person. So if you donate $12 a month, it will help us to educate about the 12 symptoms, and it will really help to make a huge difference in the world. So if we come to the end of the session, if you have any questions, you can always contact me. So like I mentioned just now, I'm doing this as a volunteer. I'm not paid. And this is because I really believe very strongly in the quality of the training by Know Your Lemons, and also the app and all the support that they are providing to people around the world. So I really wanted to be part of this. And so, yeah, thanks for attending this class, filling up the feedback form. You can check your emails for your coupon for the shop. And so, yeah, thank you for being here today. And I will put the recording up on YouTube. Thank you for coming.